Good morning, Texas, and welcome to our Summer Health Series. All summer long, we will bring you current health information that may be important to you and your family. And we begin with a look in the mirror. Remember the movie Poltergeist when Craig T. Nelson stood in front of the mirror and said before, after? Well, very few of us have the exact body shape we want, and as we get older, we tend to lose the shape we had. Dr. Bill Johnson of Innovations Med Spa, he's here with cutting-edge techniques to help reshape the body. Hello, Bill. How are you?
Good morning.
Let's talk about the history of reshaping our body. What did people used to do to try to reshape their definition?
It goes back centuries, Amy. You can think of back in Europe and for many years people using corsets and hoops and other things that weren't very comfortable and really didn't change the body shape. They just kind of fooled the eye. And then we go into some of the fads in the 50s and 60s, like the vibrating belts and the rollers and the sweatsuits and those kind of things, all trying to move fat from one place to another. And the problem is our bodies just don't let that happen.
And well, there's a good news here. The good news is technology allows us to actually move fat from one place to another. When did treatments that really work become available?
So we really started seeing effective treatments in the 70s and 80s. And of course, when it comes to body shaping, probably the king of the hill is liposuction.
Okay, and liposuction has changed and evolved so much over the past 25 years, is that right?
It's been about 25 years, and the original liposuctions were done under general anesthesia, so you were knocked out. They used big cannulas, and things have progressed a lot in the past 25 years.
So that you don't actually have to be knocked out completely at all, and it's a lot more comfortable.
Yeah, Tumescent Anesthesia, where we are able to use a local anesthetic and let the patient be awake, is probably one of the very biggest advances. And that has really increased the safety and decreased the recovery time, because so much of the recovery time was just the anesthesia.
Sure, when you're knocked out like that.
And then we also have a lot of new and exciting tools like Smart Lipo or Vaser, which both use Smart Lipo uses a laser to melt the fat, and then very importantly, the laser also tightens the skin afterwards. And Vaser uses ultrasound to melt the fat and makes it less traumatic and easier.
Which is safe and less traumatic and easier. Sounds good to me. And what are we seeing here? This is the effects of Smart Lipo?
These are Smart Lipo patients before and after. And not only did we get the decrease in size and the improvement in the shape, but we get good skin tightening, which is what the real claim to fame of Smart Lipo is.
I would think the benefits of not being completely knocked out, besides the safety issue that you mentioned, but also they can participate, your clients, in the procedure because they need to be able to move and to speak to you,
and
right?
Especially if we're doing real fine detailed work. I'll even have the patient stand up or move around for me so that I can get them in the position we need and evaluate where we are in the process.
Really great. Okay, let's talk about moving fat around in the body, because this is a good option for people who may need a little less here and a little more there.
Well, and that's been a real advance. Is the old thought of I don't want it here, I'd like it here, is now available. So we can actually do liposuction on area and then take that fat we remove and put it in this case, we're talking about a Brazilian lift where we put it into the buttocks and get a lift inside the buttocks and an improvement in the shape.
That's amazing. Have you seen these dramatic results for yourself where you really make a great definition in the derriere?
Yeah, we've really seen it, and folks are really pleased. And we can do it in the breast, so that we can move fat from the thighs or the abdomen into the breast. And it helps especially in women that have had a pregnancy, had some volume loss, got some stretched skin, and we can come back and restore some of that pre-pregnancy shape.
All right, what if we don't want surgery?
Well, if you don't want surgery, Thermage is a great option. Thermage uses radiofrequency heating to tighten the skin. And if you wanted just, in fact, when we did a patient on the air last month, she lost right at 1 inch in her waist and 2 inches in her hips.
It's that immediate gratification.
Immediately, and she's going to continue to see more results over time.
And again, another good procedure for maybe somebody who has just gone through a pregnancy who just needs that loose skin tightening.
Very nice.
Quickly, what's on the horizon for these cosmetic procedures? What's coming up next?
Well, the next big area in body shaping is the ability to destroy fat cells without breaking the skin at all. And there are a couple of technologies like UltraShape and Liposonics that promise to do that. Right now they're still in FDA trials, so it's probably 2 or 3 years before they become available.
But technology is getting better and better.
It really is exciting.
And there's so many great options for us who are looking to reshape. Thank you so much, Dr. Bill Johnson. We appreciate it. For more information about the body reshaping techniques that Dr. Johnson mentioned, log on to innovationsmedspa.com or give them a call. It's 972-331-8844 for a consultation. If you have a question for Dr. Bill Johnson, just drop him an email. It's questions@innovationsmedspa.com.